Between the 19th and 22nd of August 2014, CEHURD, an advocacy organization, collaborated with various partners in health service delivery to organize a health camp in Nyenga and Najja sub-counties of Buikwe district. Members of the community started queuing as early as 8 a.m. to access the free medical services offered. HIV/AIDS testing and counseling, safe male medical circumcision, sensitization about medicine uptake and nutrition are some of the HIV/AIDS related services that were offered by collaborating partners like St. Francis Nyenga Hospital, St. Francis Nyenga Healthcare Services, and ASD.
Ekindeese wano okukomola mwana era nyambiddwa bulungi sifunye buzibu bwonna sinaba kubulabaawo.
With this camp that we've had for the whole week as Nyenga St. Francis circumcision team, we've really managed to circumcise a number of males from the age of 15 and above. The turn-up was good. In the beginning, the first day, the turn-up used to be low, but as time went on during the week, we managed to gather the numbers through the mobilization, which was done over the radio, over the drives. We managed to get the numbers that we needed. And people were really encouraged to go on with other services. The people we received as Nyenga St. Francis who came for the service that we are offering, most of them good enough through the mobilization we did, were really sensitized enough about the services, especially circumcision, whereby they came knowing what service they really needed. They came well informed and came eagerly to receive the service, which they did. That was a positive on us, because on our work we were limited on wastage of time, because it was mostly booking, cancelling them, and then preparing them as quick as possible. So we managed to circumcise the numbers that we did.
People have got almost the services they need. They have got VCT, they have got treatment for opportunistic infections and other diseases. And people have been, they have known the services that they can access from different service providers. We got people with different problems. We got people who are already in care. We had people who didn't know their cell status and who didn't know where to access treatment from. And they managed to get where they can get these services from.
This health camp was also organized as part of advocacy to reduce stigma against persons living with HIV and raise awareness on the need to test for HIV/AIDS among fishing communities, a project supported by the AIDS and Rights Alliance for Eastern and Southern Africa, ARASA. This led to the formation of PL-HIV networks, who among others gave testimonies on living positively and offered advice to both the infected and affected.
Nasangibwa nga ndi mulwadde w'akawuka era ndudde nako ne bba wange era naye akalina, naye buli gwe bakebedde wano mbasaba busabi mugume, temubaako na kutya, temubaako na kweraliikirira, kubanga ffenna bwe tutyo. Ate leka mbabuulire, temulowooza nti oba abo be mulaba nti oba kubanga muyinza okulaba nti oba oli kubanga afaanana bw'ati oba afaanana atya. No, ffenna tomanya, sooka ogende bakukebere balabe bw'ofaanana, kwegamba omanye ki ky'oli. Naye omuntu nga tonabagenda kukuggyako omusaayi kukebera, tojja kumanya ki ky'oli. Ate n'oli akugamba nti gwe oli mulwadde, gundi oyo mulwadde akusongamu omuno, ye mulwadde, kubanga gwe kati gwe weemanyi nti oli mulwadde, naye ye tamanyi kati ye mulwadde, kubanga gwe omanyi era otandise n'eddagala. Kale mbakubiriza bannange, buli gwe bakebedde ne banasangibwa nti mulwadde atandika eddagala. Ate bannaye mbabuulire, buli ali ku ddagala n'abakadde abalimira, toyosa kumira ddagala. Eddagala batugamba tolyosa, naddala RVs oyo toyosa, era lw'oyosa ng'ogwa wansi ate okusituka buzibu.
This health camp was an opportunity to affirm that advocacy organizations, though not in service delivery, can play critical roles in contributing to access, availability and affordability of health services by bridging the gap between communities and health service providers. While working towards achieving the right to health, CEHURD had such an opportunity to do more than generating evidence for advocacy.
As you have realized, fishing communities are one of the most at risk populations within this district, since the trading that happens at the shore and the landing sites. So this was very good for us to have the HIV/AIDS services coming on board to provide these health services. So we were 2 days in Nyenga sub-county, where the turn-up was really good. We had different people coming in, especially those who wanted their children to be circumcised, and we had many numbers testing for HIV and being cancelled. Now that we are in Najja, it has exactly been even more overwhelming than Nyenga, and we had even some people that were not able to come to Nyenga actually come here to Najja.
We greatly acknowledge the support and cooperation of the District Health Officer, Buikwe District Woman MP Honorable Dora Mpima, Kawolo Hospital, Buikwe Hospital, Makindu Health Center, Buikwe NGO Forum, Kampala Pharmaceutical Industries KPI, CEHURD Community Advocates for Health and Human Rights, Allied Teachers Secondary School, and Sacred Heart Girls School.